don't really know that much about it.
As far as I'm aware, type 1 diabetes is where somebody's immune system begins to attack itself.
It's an autoimmune disease. Your body's natural defence mechanism kicks into action and unfortunately attacks the beta cells in the pancreas.
If something happens, because I don't really know what causes it, but it could be like a virus, or I think for me I had a fit when I was younger, it could have been that.
And unfortunately it attacks the beta cells in the pancreas, so it stops the production of insulin.
Well, I wasn't there when you were born. Your grandpa came to look after Jessica.
It was lovely. It was lovely. You were a girl, obviously, and that was something that I wanted, a second daughter.
You were a big baby, you were a big podgy. And I thought then there was something wrong, and I don't know whether I'm right or not, but you didn't look right to me. You were really, really podgy.
When I came down, you were about a week old, and you were a chubby little baby with a big mop of hair, particularly on top.
You had all these curls on one side, and then you had this piece of straight hair that used to just come out at the top of your head and come over.
You liked your sleep. You still like your sleep.
Devil child. So you had a real temper. You used to sweat all the time. You had a real temper.
You were a bit of an angry child at times. You would throw yourself on the floor and have temper tantrums.
I noticed you used to get very clammy, and you did like your sleep, but you used to get quite bad-tempered really for a little girl.
When Izzy was younger, before she was diagnosed, she was very aggressive and short-tempered, and I think it's because she didn't really know why she was feeling so horrid inside, and she couldn't control it, and so she would just lash out. And
you get tired. I think you would get tired, and you know, I thought you should have had more stamina. You're always thirsty, but it was your mum that picked it up first.
You constantly were thirsty all the time, ridiculously thirsty. You would panic if you didn't get a drink, if we didn't go out with a drink. You know, you were like somebody that had been abandoned in a desert. You were so thirsty all the time. It took a while to get doctors to listen, because they just thought I was a paranoid mother.
Kept getting urinary tract infections, and you just don't get them as a child, and it's just from having too much sugar in your pee. And your mum, being a midwife, she got strips to test urine.
my parents were frequently rushing to do urine samples, and they were getting sent off to the doctors.
And so it was probably about the third time of taking you to the doctors that they did a urine test, and that came back positive. Then eventually they did a blood sugar test, and that came back quite high.
Your sugar was high, and it was your mum pushing it with the doctor to do tests that they got it fixed.
They used to say, I think up here they kept saying you were borderline, and it wasn't till you went to Gloucester that they really diagnosed it as definitely diabetes.
The first thing that went through my head was failure as a mother.
I didn't know a lot about diabetes at the time, the difference between type 1, type 2, could you take a pill, could it reverse, and then once I understood it was type 1 and what that meant, we just got to accept it and get on with it. And
I used to cry to myself when I used to have to see you, and we used to go out and then you'd have to give yourself an injection.
we all remember the first finger prick. My lord.
I remember the first finger prick starting off as really funny, and parents were trying to make it out to be like a normal thing, it's not going to be painful, and so they were doing finger pricks, and they were doing finger pricks on one of their close friends as well, and we said, oh, Jessica, come and be the big sister and show Izzy how it doesn't hurt.
But of course, a child's skin and an adult skin are different thicknesses, so you can set the depth of the finger prick, and of course for me it had to be quite deep, and for crikey, I think she was about 6, maybe 7. It doesn't need to be as deep, and Jessica very bravely said, I'll do it first, because she always looked after you.
And so my little finger got attacked by this finger pricker, and so I began screaming in pain, which just made the whole situation so much worse and really distressing, and Izzy went like white with fear.
And we had to hold you down and do it, and we had to do it on your finger, and of course you're making fists and thrashing about. We were having to pin you down, which was even more distressing. It was awful. Bloody awful. I'm laughing about it now because you may have been scarred for a few years, but I think you've got over that punishment. It was terrible.
I mean, we were in Yorkshire then, you were down south when you were actually diagnosed, so we didn't really sort of see your first reactions to it. It was just what your mum and dad used to say.
I think you became more introverted, without a doubt. You became much more introverted.
I think it was hard for Izzy to try and like get through it because of nobody understood it. Like even our grandparents would give me more biscuits than Izzy because she's diabetic, and teachers wouldn't give her chocolate as a reward because she was diabetic, and it was almost like she was singled out for everything just because of the diabetes.
I think you felt very alone because you were different, but at the same time you didn't want to be with people who were like you. You didn't want to talk to people your age with diabetes.
When I was first diagnosed, I can't really count that because it wasn't really me having to deal with it. It was my parents. It was them who was doing the finger pricks and the injections for me. But as soon as it was sort of secondary school especially, a little bit in primary school, mainly secondary school, it was all on me then. It was my responsibility, as it should be. But I was crap. I honestly didn't look after it. And I know some people seem to take to it really well, but actually it took me getting in contact with other diabetics and like being on diabetic Facebook groups and stuff like that to realise that the majority of people don't cope with it, or it takes them a very long time to cope. Who wants to give an injection every time they eat or drink? No one wants to do that. You know, it's usually 7+ times a day. It's not fun. I think the most recent hospital stay is probably the most memorable.
The most recent hospital stay where, whilst filming, Izzy was in Warwick, and I'd got a phone call from one of my parents whilst I was at work saying Izzy's been out and she's been rushed to hospital because she's been violently vomiting, and she basically her blood's turned to acid because she's got ketoacidosis, I think it was.
No parent wants to see their child in intensive care. It's horrible. I've been in so much pain. They put me on a lot of morphine, and if I was a bit out of it, I do remember it. I remember and put more than about 4 different drips in, and then they put one in the artery in my wrist. And I was glad I was on morphine when they did that, because they have to, because it's such a
delicate area. We have to sew it into your wrist.
So that was really scary because we're all so far apart now. So I had to drive from my work to go and see Izzy in hospital. And when I walked in, I hadn't seen her for quite a while anyway. And she was really thin and her lips were all crusted and she just looked really ill.
I thought they were all, on the whole, they were pretty good. I think the care, the time you get with the healthcare professionals, I thought the dietitian treatment, the dietitian support was fabulous. And I think it helped when we moved to Cheltenham because she was a diabetic as well. And I think you respected more what she said for that. I think you always struggled with dealing with people who might be a healthcare professional but didn't have diabetes, so it's like you don't understand.
Some of Izzy's nurses have been really nice. I didn't think at the time. She had one doctor who was her consultant when we were living in Cheltenham, and I thought she came across as really bossy and aggressive, but actually she probably cared the most about Izzy.
They're all extremely well-meaning and cared. Dr. Abitha, I think, was extremely patient. I think towards the end, when you were coming of age, she started to lose patience with you.
And then I think the doctor who you've had, who was in Warwick as well, he was a really good doctor and seemed to care.
I would say, on the whole, they've been fantastic. They've been fantastic. The team that you have at the moment are probably the most proactive and most caring of professionals you've got. You know, they want to do what's right for you and by you, and they want to give you all the encouragement and support they can to help you manage your diabetes better.
In the end, there's a lot worse out there, and I know a lot of people who have lived with it for a lot longer than I have, and they're doing fine. So yeah, just got to take each day as it comes. I'm happy to be here. I'm still here. A lot of people aren't. So take each day as it comes.